let's demystify what those terms mean. What are psychosis? What is schizophrenia?
Yes. Psychosis can describe a state of having a change in behavior, change in perception, maybe starting to, I think classically you hear about things like hallucinations, starting to hear things or see things that aren't there, that other people don't experience, maybe developing false beliefs, thinking that other people are talking about you, thinking that maybe somebody's following you or going to hurt you. But there are other symptoms of psychosis that are not always recognized as psychosis. Thought disorder, having some kind of alteration in the flow of thought. Maybe things get jumbled up and confusing. It's hard to communicate. And then there can also be what are called negative or deficit symptoms, a loss of interest or pleasure, maybe not showing very much emotion, not showing motivation. So it's really all of those things together. And psychosis can characterize a lot of different situations. So for example, somebody could be high on drugs and show psychotic symptoms.
Chemically induced.
Right, chemically induced. There can be rare medical problems that can cause psychosis, like a brain tumor, for example, could cause a psychotic symptom. But the most common forms are schizophrenia, and then sometimes mood disorders, such as bipolar, manic depression, or depression can have psychotic symptoms along with them.
Listening to you talk, I was channeling back to our discussion just before the show started, and that is so many of the things that you mentioned go along with being a teenager, for example. And I think every parent at some point worries that their kid might be depressed or have lack of motivation or is not interested in engaging and have at least superficially seem like they have some of these.